The pain in my left knee was so severe that walking up and down stairs was almost an impossible task. I was struggling to play with my grandbabies. I like to walk my dog, and I was even having trouble doing that. I felt like it was ruining my whole day. I was a PE teacher for 32 years at a middle school. I spent quite a bit of my day walking to and from the fields. The golden years became not so golden when this pain started in my knee. And then all of a sudden, because of the pain, I was finding I was having trouble doing my fun things in life. And so I went to see Dr. Barron.
When folks see us for the first time, they're obviously, I think, fearful of what we might discuss. And so I think it's a fragile time, it's a very vulnerable time, and it's a real privilege to be able to walk into that space with people.
It's not just the knee or the hip that we're treating. It's the whole patient, and there's a lot more to chronic pain from a knee than just the knee pain. Making the patient feel complete again is what we're out to do.
Dr. Barron's office staff, from the moment I arrived from my appointment that day, was so professional. I had to have x-rays, and she was wonderful. His nurse took me back, and she was delightful. He came in with a big smile, shook my hand. He showed me on my x-rays that it was bone on bone, and that the pain was because of the arthritic situation going on. He said that he was there to help me, that he was not going to push me into this, but it was going to improve my quality of life. When I heard that, I was ready to go for it.
Technology in the medical field has improved dramatically, and at Midwest we seek to utilize that as best as possible and really provide an innovative approach to orthopedic and joint care. That may be done with a quick rehab, like with anterior approaches to the hip, or with partial knee replacements, and especially with outpatient joint surgery.
People used to think that I want to go to the hospital and have people take care of me. Now they would much rather go home. The familiar environment that they have at home, I think, helps facilitate the healing process.
Dr. Barron did my surgery as an outpatient, and I was on my couch at 7 o'clock that evening. I would highly recommend outpatient to anybody that can do it. The quality of my life is so much better with my new knee. I can do stairs like a normal person, 1 foot in front of the other, up and down. I can get down and play with my grandbabies. I can walk my dog, and I golf quite a bit with my husband.
You know, when people are dynamite after a 1-hour operation, it's really humbling, and I'm very grateful. I tell people when they're better, I'm better.
That's a good feeling to know that you've helped somebody get back to their normal life again.
We want them to walk without pain. We want them to get back to the things they love doing, and we want them to feel complete.
The most exciting thing for me is seeing patients come back into the clinic with a huge smile on their face, knowing that they've gotten their life back.
I will say that with my new knee and Dr. Barron's help, I have my life back, and my golden years are now golden again.